Are you afraid of falling? Maybe you have never said it out loud, but your body is already acting as if you have. You choose the shortest path so you do not have to go down steps. You prefer to stand near something you can hold on to. Your balance changed after 60, and you feel it, even if you do not know exactly when it started. And there is more. That knee pain that comes and goes, that is sometimes mild and sometimes catches you by surprise. Has it ever made your leg betray you? Has it ever made you feel unsafe in a simple situation, like crossing a parking lot or getting off the bus? If you said yes to one or more of these questions, this video was made for you. I am a physical therapist, and what I see every day is that knee pain and loss of balance are often not two separate problems. And today, we are going to address both together. First, you are going to do a test, the same one I use with my patients, to find out exactly where your balance is right now. And then, we will talk about what to do to solve this problem. I will teach you 5 simple exercises that you can do at home. We will progress between strength and balance, and number 1 is the most important of all. Stay until the end, because in the bonus section, I will reveal a daily habit that is destroying your balance without you realizing it, and that almost no one connects to knee pain. Before any exercise, I want you to do something with me right now. A test. Simple, quick, less than 30 seconds. But what it reveals about your body is much deeper than it seems. This is the same type of assessment we use in the clinic to understand where a patient's balance is. And studies show that the amount of time a person can stay in this position is directly linked to muscle health, joint stability, and the risk of falls. Before we begin, a word about safety. Stand near a wall, a sturdy chair, or a countertop. Not because you are going to fall, but because we want you to focus on the test, not on holding on. If you feel dizzy at any point, stop immediately and hold on to something. Ready? Here is the test. Stand up. Find a fixed point in front of you, an outlet, a picture frame, anything at eye level, and focus your eyes on it. Now lift one leg, bending your knee, and balance on your supporting leg. You do not need to lift it high. What matters is keeping your foot off the floor for as long as possible. When your foot touches the floor, or when you need to hold on to something, mentally note how long it lasted. That is your result. You can start. Now let us see what that number means. And I want you to be honest with yourself. There is no bad result here. There is only a starting point. If you are between 60 and 69 years old, a good result is between 20 and 25 seconds. Between 70 and 79 years old, 15 seconds is already a great number. If you are 80 years old or older, 8 seconds is excellent. Were you below what is expected for your age? That is exactly why today's exercises exist. Balance is a skill, and skills can be trained. Were you at or above what is expected? Great. Today's exercises will help make sure you stay that way. Tell me in the comments how many seconds you lasted and how old you are. You will be surprised by other people's answers. Now that you have your number, let me explain what is happening underneath all of this. The knee does not work alone. It is the body's midfield player, positioned exactly between the ankle and the hip, depending on both of them to function well. When this chain is balanced, the knee distributes weight efficiently and movement flows. When something fails, above or below, the knee pays the price. And that is where pain comes in. When the knee starts to hurt, the body does something that is smart in the short term and devastating in the long term. It protects. It reduces the range of motion. It recruits the surrounding muscles less. It asks you to move less, and you obey because it hurts. The problem is that this silent agreement between you and your body will weaken exactly the muscles that support the knee and control your balance. Glutes, quadriceps, calves. These 3 are the pillars of your stability. And when they become weak, the nervous system loses precision. It can no longer calculate where your body is in space with the same accuracy as before. This has a clinical name: proprioceptive deficit. In simple terms, it means that your body has lost part of its ability to orient itself without relying on vision. That is why, In the dark or on uneven ground, insecurity increases a lot. That is why the knee and balance are always together in this conversation. The good news is that this system responds to training. The muscles can be reactivated, proprioception can be restored. And the 5 exercises we are going to do now were chosen exactly for that, to rebuild this chain from the ground up, safely and progressively. But before we begin, let us make an agreement. Mild muscle discomfort can happen. That is normal and expected. What should not happen is sharp knee pain during the movement. If that happens, stop the exercise. Let us start with number 5. Exercise 5, weight transfer. And I start with this exercise on purpose. Because before asking your body to do something difficult, I need it to remember how to do something fundamental, distribute weight consciously and with control. It seems simple, and it is. But you will feel that it is not as automatic as it should be. Stand with your feet hip-width apart. You can face a countertop, a tall chair, or a wall. Not to hold on, but to have support nearby in case you need it. Keep your knees slightly bent, never locked. Shoulders relaxed, eyes looking forward. Now, slowly, begin to transfer your body weight to the right side. This is not an exaggerated hip movement. It is subtle. You will feel your right foot press more into the floor and your left foot lighten. Stay in that position for 2 seconds, then transfer to the left, 2 seconds, and return to the center. The secret is in the speed, or rather, in the lack of it. The slower you do this movement, the more your nervous system works to maintain control. It is exactly this slowness that turns a simple exercise into real balance training. Be careful not to make very common mistakes. The first is moving your hip to the side as if you were dancing. The correct movement comes from the weight, not from the hip. And remember your breathing during the transfer. Breathe continuously because the brain needs oxygen to process balance. If you want to make it easier, increase the distance between your feet a little. A wider base, more stability. If you want to progress, close your eyes during the transfer. You will feel a huge difference. Do 10 transfers to each side at a slow and controlled pace. 2 sets. Now let us move on to number 4. This one works a muscle that most people underestimate. Exercise 4. Standing calf strengthening. And before I show you the movement, I need to tell you something that most people do not know. The calf is not just a leg muscle. It is what cardiologists call the second heart. When it contracts, it pushes blood back upward against gravity, returning it to circulation. But beyond that, it is one of the main muscles responsible for your balance. It is the calf that makes the constant micro-adjustments that keep the body from swaying when you are standing. When the calf is weak, the body loses stability, especially on uneven ground or when you need to react quickly to a loss of balance. Stand facing a chair or countertop with your hands lightly resting on it, only for safety, not to support your weight. Feet parallel, hip-width apart, knees slightly bent, never locked. Now slowly, rise onto the balls of your feet. Go as high as you can, without rushing, without momentum. Feel the calf muscles contracting. At the top of the movement, hold for 2 seconds, then lower with the same control, slowly, until your heel touches the floor completely. The secret is in the way down. Going up is easy. That is gravity working in your favor. Coming down with control is where the muscle truly gets stronger. Do not let your heel drop. Guide it to the floor as if the floor were fragile. If you want to start in a more accessible way, do the movement with both feet at the same time and at a slightly faster pace. To progress, try doing it on one leg, holding the chair, and feel how the challenge changes completely. Do 15 slow and controlled repetitions. 2 sets. Now let us move on to number 3. And this one has everything to do with the result you got on the test at the beginning. You will understand when we get there. Exercise 3. Standing side leg raise. And now I am going to introduce you to the muscle that is probably at the root of your balance problem, the gluteus medius. It is located on the side of the hip, and most people have never heard of it. But it is the guardian of your stability. Every time you take a step, It is the muscle that keeps your hip from dropping to the side. Every time you stand on one leg, like in the test we did, it is working behind the scenes to keep you upright. When the knee hurts and movement decreases, the gluteus medius is one of the first muscles to weaken. And when it weakens, the knee starts receiving a load it should not be receiving, creating a cycle that makes both problems worse at the same time. Stand sideways next to a chair or wall with one hand lightly supported. Feet parallel, posture upright, eyes looking forward. The leg that will work is the one on the outside, away from the support. Now, keeping the knee straight and the foot flexed, toes pointing forward, not upward, lift the leg out to the side. Raise it as far as you can without leaning your torso to the opposite side. At the highest point, hold for 2 seconds. Then lower with control, without letting the foot hit the floor. The secret is not leaning your body. It is tempting to compensate by leaning your torso toward the support side. This completely takes the load off the gluteus medius and transfers it to the lower back. Keep your torso straight as if there were a wall behind you. Be careful not to rotate your foot upward during the lift. This changes the muscle being worked and reduces the benefit. And do not lift the leg too quickly. Speed here is the enemy of results. To progress, add a light resistance band above your knees and feel the resistance increase. Start by doing 2 sets of 12 repetitions on each side. Now let us move on to number 2, and this is where the training starts to get closer to real everyday movement. Exercise 2, controlled step up. Going up a step, getting on the bus, stepping onto the curb. These are situations that happen every day, and they require exactly what we are going to train now: knee strength, hip stability, and movement control on one leg, all at the same time. You will need a sturdy step, a staircase with a handrail, or a low-step platform. If you do not have any of those, a stack of catalogs or a stable platform about 15 centimeters high will work. The handrail or a wall beside you is essential, not to support yourself with force, but to provide safety. Stand in front of the step. Place your entire right foot on it. Not just the toes, the whole foot. Now press your right heel into the step and step up, bringing the left foot with you. Lower the left foot first, back to the floor, and then let the right foot come down afterward. Slowly, with full control. The secret is pushing through the heel, not through the toes. When you push through the heel, the glute and the quadriceps work together the right way. When you push through the toes, the knee moves too far forward and absorbs a load it should not. Pay close attention to how you do the exercise. One mistake I see a lot is using the bottom leg to push the movement. The leg that is on the step is the one that should do all the work on the way up. The controlled descent is where eccentric strength is built, and that is exactly what protects the knee in daily life. Oh, and watch your knee so it does not collapse inward. Keep it aligned. If you want to start in a more accessible way, use a very low step and hold the handrail more firmly. To progress, gradually increase the height of the step or hold a light weight in each hand. Let us do 10 repetitions on each side. If everything feels fine with the knee, do 2 sets. And now we have reached number 1. The most important exercise in this video, and the one that will change the way your body moves outside of here. Exercise 1. Tandem walk. Everything we have done so far was preparation for this moment. The weight transfer taught your body to redistribute itself with awareness. The calf rebuilt the foundation. The gluteus medius reactivated the hip stabilizer. The step-up restored functional strength to the knee. Now we are going to put all of that together, in motion. The tandem walk is the exercise that comes closest to what the human balance system was designed to do. It is challenging. It is uncomfortable at first, and that is exactly why it works. Find a hallway, a line on the floor, or imagine a straight line in front of you. Stand at the beginning of that line. If possible, walk near a wall. It will not hold you, but it will be there if you need it. Now take the first step by placing your right foot directly in front of your left. The heel of the right foot touching the toes of the left foot, exactly as if you were walking on a tightrope. Then the left foot moves forward, heel touching the toes of the right foot. And so on. Keep your gaze fixed on a point ahead, never downward. Arms slightly open at the sides of your body to help with balance. Slow and deliberate movement. Each step is a conscious decision. The secret is not rushing. The temptation is to speed up, to get through the hard part quickly. But it is exactly in the slowness that the nervous system learns. Every millisecond of instability that you move through without falling is your brain being retrained. Do not make the mistake of looking at your feet. When your eyes go down, the vestibular system loses its reference point and balance immediately gets worse. And pay attention so you do not open your feet out to the side when instability appears. Resist that impulse. The instability is the training. Start with 5 steps forward and 5 steps backward. That is 1 set. When you can do it without touching the wall for a good while, you can try closing your eyes for 2 or 3 steps and feel how the difficulty level changes completely. But remember safety, always near something you can hold on to or close to someone. This is the most powerful progression there is for balance. Do 3 sets, rest 30 seconds between them. And always remember, mild muscle discomfort can happen. Sharp knee pain should not. If it appears, stop and rest. You stayed until this point, so I am going to keep my promise and talk about the bonus. There is a habit that most people have every day, several times a day, that is silently sabotaging their balance. And the worst part, it is something that seems completely harmless. The phone. Not screen time, that is another conversation. I am talking about one specific moment, when you are standing and look down to check your phone. It seems trivial, but what happens in the body at that moment is much more serious than it seems. When the head moves forward and down, even for just a few seconds, the body's center of gravity shifts. The human head weighs on average 5 kilos. When it moves just a few centimeters forward, the load on the cervical spine can triple. And the vestibular system, which is your internal GPS for balance, becomes temporarily disoriented. Now imagine doing this dozens of times a day, standing in line at the grocery store, waiting for the elevator, walking on the sidewalk. The balance system never gets to fully stabilize because every few minutes it receives a new confusing signal. Over time, the body begins to adapt to this posture. The muscles in the neck and upper back become chronically tense. The posture shifts forward, and balance, which depends on an upright posture and a well-calibrated vestibular system, gradually gets worse. The solution is not to give up your phone. It is simple. Whenever you are going to look at your phone while standing, lift the device up to eye level. Instead of your head going down to the phone comes up to your head. A seconds-long adjustment that protects your balance over the years. Before we finish, I need to give you one piece of guidance that makes all the difference between results and frustration. Your starting point has already been defined. You did the test, you have your number. And it is from that number that progression starts to make sense. In the first week, the only goal is familiarity. Do the full sequence twice, on non-consecutive days. Do not add repetitions. Do not force progression. Let the nervous system learn the movement patterns without rushing. In this phase, losing your balance and correcting yourself is more valuable than doing everything perfectly. In the second week, add a 3rd training day and start experimenting with the progressions I mentioned in each exercise. Closing your eyes during the weight transfer, doing the calf raise on one leg, increasing the range of the side leg raise. Choose one progression per exercise, not all of them at the same time. In the 3rd week, redo the flamingo balance test. Time yourself again. Compare it with the number you got today at the beginning of this video. That number will tell you everything you need to know about what is working, and it will give you a kind of motivation that no words of mine can provide. Balance does not improve from one workout to the next. It improves from one week to the next, quietly behind the scenes, until one day, the body simply responds differently. And you will notice it. If during the test you felt dizzy, or if your balance gets worse in places with a lot of visual movement, like shopping malls, busy hallways, or while watching television, this may not be just a muscular issue. Human balance depends on three systems working together: the muscles and joints, the vestibular system, which is located in the inner ear, and vision. When the problem comes from one of these other systems, today's exercises help, but they do not solve it on their own. Likewise, if your knee pain is intense, getting worse over time, or comes with swelling, locking, or a feeling of instability, an individualized evaluation with a doctor or physical therapist is the right path. Not because the exercises are dangerous, but because your body deserves a specific look at what is happening with it. Take care of yourself with intelligence, not just with effort. Now, if this video made sense to you, go ahead and subscribe to the channel. If you recognized yourself in the questions at the beginning, if the test surprised you, if any exercise made you feel something you had not felt in a long time, tell me here in the comments. Read other people's answers. You will realize that you are not alone in this. See you in the next video.